Trenger du å erstatte en tann, men nøler grunnet frykt for smerte? Gjør det egentlig vondt å få implantat? Dette sier tannlegen om implantat og smerte.
Most of the people think like, oh, Mauricio, are you gonna put an implant inside of my bone? That looks like so painful. No, it's not like that. Why? Because we have a lot of medication that can improve that kind of pain before, after this surgery. And one thing that patient must know, the bone, when we put the implant in the bone, we don't put in anesthesia or vice inside of the bone. No, we put vice or anesthesia in the gingiva. Just in the gingiva, it's not gonna feel pain inside of the bone. When you feel pain inside of the bone, when we are close to these anatomic nerves, or when we are close to some infection or stuff like this. But normally, one implant, I think the level of pain is too low if you compare with one extraction, for example. What happened when we we take off one tooth? That we had to make some kind of a press, and you feel discomfort, you know. And after, when we took this tooth, it's gonna be a hole. That's the place from the previous root. So what happened if you don't if you don't take care about this extraction? You're gonna have some kind of called alveolitis. That means that the bone of your extraction gets infected. Why? Because the clot of the blood is just going out, because you just spit up and the clot just go out, and then the bone is like empty and there is no blood inside. So what happened? You're gonna have alveolitis. There is an infection. When we put an implant, we make a hole. It's more or less like 3 millimeters, the normal 3.5 more or less, and we put the implant. So there is no hole. It's something that is covering this bone. So that's why the implant is not so painful as extraction. With extraction, you have more risk to have pain after, but with the implant, no.